So I actually made a book and I termed it My Nursing Bible. And you guys, I turned those templates into an actual template and I have made it available for you guys. And what it would do, it would ensure that you would actually have one place to go to ensure that when you are going to a new unit or starting as a new nurse, that you can create your own nursing Bible. Hey you guys, so I want to make you aware of a new template that I have downloaded under the Nurse Collective that is linked in the Stand store. So when I became a nurse and I went straight into orthopedics, it was a fast-paced unit and everything was just all over the place. I was overwhelmed, and I remember just having so many different people, pouring to me and giving me tips and tricks, and I will always have post-it notes, writing things down, and at the end of the day I had this big pile of just notes, and I'm like, this is so confusing because I will always have to go back to it. So I actually made a book and I termed it My Nursing Bible. And you guys, I turned those templates into an actual template and I have made it available for you guys. And what it would do, it would ensure that you would actually have one place to go to ensure that when you are going to a new unit or starting as a new nurse, that you can create your own nursing Bible. And comprised in this bundle are, first and foremost, a template that will allow you to remember important medications. Second, a template that will allow you to remember important skills, that will help you remember important procedures. As I want you guys to be able to adequately go through your journey and go to your new floor and feel organized and feel like you have one place to go to and adequately help you through your orientation process. So do yourself a favor and go to the Stand store and download the My Nursing Bible bundle templates that will help you ensure through your orientation process successfully. We're going to go get into actually filling out template 1 of the nursing Bible. And so basically this is the first template, and this is dedicated to medication. So when you're going to a new unit, you're going to find that you have a lot of medications that are specifically used or commonly used when you are on the unit. And so we're going to fill out for heparin. And so if, for instance, if I was starting with the new nurse Bible template, I would basically come in and I would write heparin, which is the generic name. And the brand name for heparin is Hep-Lock or Hepalon. And then the drug class, heparin is an anticoagulant and a antithrombotic. The therapeutic use, heparin is used in the case of DVTs, which are deep vein thrombosis. And these are blood clots in deep veins. We also have it being used in the case of pulmonary embolisms, which are blood clots that travel to the lungs. And we also use it in the case of atrial fibrillation. We also see it in patients who have experienced a heart attack, strokes. It is given also after certain surgeries, as I said, because they're not getting up to walk as they would normally if they didn't have a surgery. And you see it also in kidney dialysis. So if you're a dialysis nurse, you are working with heparin a lot. Okay, so we're going to continue on in filling this out. Some of the common side effects of heparin are bruising. You'll have bleeding, of course, allergic reactions can happen as well, and of course nausea and vomiting. Okay, so some contraindications for heparin is not to use in patients who regularly test for blood coagulation. Okay, as far as assessment, now this is the main thing in nursing interventions. Review patients' current meds, if they are taking other medications that are also anticoagulants as well. Check for their allergies. And we do that just because even though the pharmacists are checking these medications, you want to make sure medical conditions. And on this template, you can actually write specific things. Bleeding disorders or liver and kidney disease. Also, nursing interventions. Whenever you're giving something, I would say via sub-Q to change injection sites. And any other pertinent notes that you may have there. I love this because I can create and fill this out any way that I want. so that I can readily remember this medication. And something that I put down at the bottom for you guys, the tracker. And so if you find that basically, hey, I don't really understand heparin, you can put low. If you feel like, look, I know all about heparin, you can circle high. And it basically allows you to view your competency on these medications, these skills, and these procedures. All right, so the next template in the My Nursing Bible bundle would be the skills template for a Foley catheter. So one thing I can remember is that when I will always do skills, specifically the skills that I wasn't too aware of, I will always forget stuff. And you hate being the type of nurse to go in and out. And so this is why I created this. So this will just help me remember that I need a clean, dry, Foley catheter. You need a water soluble lubricant, a syringe filled with about 5 to 10 milliliters to actually inflate the balloon once you insert the catheter. And then you need maybe like a clean diaper or incontinence pad to put under you when you're actually administering the Foley. And when I actually inserted, because I realized once I started, there are policies at every hospital. And so for instance, I would write down the actual address. If I worked at, I don't know, make up a hospital, Love Hospital. And then the, I don't know, policy was foley.edu.com. And then that will basically be where I will know. This will basically inform me the next time I have to do this skill, where I can go to actually have the policy. And for instance, you can either take the policy wherever you find it on the internet, print it out, and actually staple it or paper clip it right here. And that's what I kind of did when I first started, so that I can have the policy right in front of me. All right, so far as assessment, and then for me, a lot of times, just a note, grab an extra kit. So far as the steps to inserting the Foley, you can actually write them out here, or you can attach the policy here. And of course, we all probably remember how to insert a Foley, but you feel like there are steps you're missing, you can actually place that there. So by the time you finish filling this out and completing so many different Foleys, you guys, you will be at the competence tracker level of high. And so, yeah, I would write all over this thing and have so many notes. The last template we're going to fill out is procedure. And common procedures that I have given as a nurse is blood administration. You need a unit of blood. You need a vital card. Some other things you may need, normal saline and blood tubing. Okay. And as far as assessment and nursing interventions, in the CNA, obtain a recent set of vitals. And I believe that the recent should be within an hour of giving the actual blood. In that case, what I remember, you need to basically obtain a doctor's order. And once you get the doctor's order, then you can release that order. And then there is a piece of paper that you will actually print out. In the hospital, I can only go off of how I do it. In the hospital, you have a piece of paper, and then take that blood transfusion paper down to the pharmacy to actually get the blood once the pharmacy tells you that it's ready. So you have a doctor's order. Then you need to actually attain a doctor's order. You need to check for a consent. If you do not have a consent form from current admission, you guys, you need to have basically a current typing cross. And once you have all those things and a recent set of vitals, and they call you to go get the blood, then you go get the blood. Once you've received the blood, this is a note that I will put for myself, should be given 30 minutes, within 30 minutes of obtaining from the lab. It needs to physically be going into their veins from the lab. You prime the normal saline, You perform your 2 checks. With another nurse. And then you can basically start to administer blood, and you can fill this out as much as you can. You want to talk to the patient and inform them of all side effects. So some common side effects are fever, chills, hives, and itching. And you need to tell them that if you actually experiencing any of these, to let me know. And you guys, some important thing is that when you are done, another note is to stay in the room 15 minutes after blood has been started. Vitals need to be taking 1 hour within blood being given, and then immediately once blood finishes. Just to review, these templates were formed just to help you get acclimated to a floor that you can have a go-to compilation, so that you can have a go-to place where all the important things you need in order to adequately successfully take care of patients on a unit or as a new nurse can be. And you guys, I pray that this is helpful. It was helpful for me, and I still have my new nurse binder. And when you are done and you print out these templates, you can print them out, hole punch them, put them into a binder, or you can put them into a slidable case, however way you want, and you can keep it in your locker, keep it somewhere stashed on the back of your computer browser, keep it at home, and so when you're done your shift, you can insert them in there.